So, as I mentioned toward the beginning of our last class before the break, this is the adjustment unit of your textbook. So, we're talking about what happens when things go wrong, whereas we spent most of the class talking about normal processes associated with personality. So today we're going to start our chapter on disorders, and we'll begin by just defining disorder. And we'll talk about disorders broadly, and then we'll narrow in on, on what exactly a personality disorder is. So a psychological disorder is a pattern of distressing behavior or experiences. And this definition can apply to any psychological disorder, whether it's social anxiety disorder, depression, even schizophrenia, though we won't be covering that one in here. And so this pattern of distressing behavior typically causes some type of disability or impairment. So this could be something like losing a job, losing friends, or even having health problems. So one thing that you'll see that is a common element to just about all of these personality disorders is that they can result in some problems with social relationships. And as I've mentioned time and time again in here, belonging to a group and getting along with other people is imperative to healthy psychological functioning. So if you look at the example of having a job and just keeping a job or getting a job, how well you get along with the other people at your place of work is a huge component of that. So you need to get along with your boss, you need to get along with your coworkers. I know when we're looking for new faculty members here and doing a search for candidates, we evaluate how well we get along with that person during their interview just as much as we evaluate all of their other qualifications, like their publication record and so on. So when there are problems with that, it can really cause a lot of disruption in someone's life. So these types of disorders usually put someone at increased risk of continued suffering, and in the more extreme cases, they can really become isolated, and they might even face jail time or engage in behaviors that can lead to some serious health consequences or even death. And this is typically the subject matter of abnormal psychology. So has anybody in here had an abnormal psychology class, or are you taking one right now? Okay, so a few people. So if you find this stuff really interesting, I do recommend taking a class in abnormal psych. So now that we've defined disorder, let's talk about what we mean when we say that a behavior is abnormal. Well, there are different ways that you can define abnormality. So you could use a statistical definition, and if we were to do this, we would just be saying that whatever is rare, so behaviors that are extraordinarily rare or infrequent, are not statistically normal. So you should be familiar with that normal distribution, and this would be behaviors that are outside of that normal range. The extremes of behavior, as we'll discuss it in a little bit. So that's one way of defining it. You can also use a social definition of abnormality. So whatever a given society does not tolerate is abnormal for that society. Now clearly these aren't going to be completely independent of one another. Typically things that aren't tolerated by a society tend to be pretty rare, because we learn as we develop that these things are discouraged, so we don't do them. Now, it might be clear at this point that both of these definitions are fairly relative. So they aren't absolute definitions of abnormality. Do you need me to go back then? Yeah. Oops. Yeah. Okay. Yeah. So, yeah, as I was saying, both of those definitions are fairly relative. They depend on what is normal within a given society. And as we discussed just a couple of chapters ago, although there are some things that we might consider to be cultural universals that don't really change much, there are also, from one culture to the next, there are also some things that do change depending on the culture that you're in and the part of the world that you're looking at. So one solution to this problem of relativity in this definition is just asking a person how they feel, how they're doing. So this is a technique that's often used by psychological therapists. And then if the person reports that they are having some problems, that they're really depressed, they feel like they're not fitting in, they feel like they don't have enough friends, if they report these problems, well then it's probably true that they have some problems. So this seems like a common sense notion, but it's important for trying to define psychological problems. Okay, so the study of mental disorders is called psychopathology. And does anybody know the name of the manual that clinical psychologists use to help them diagnose disorders? Yeah, the DSM-4. That's the most recent version. The most recent is actually the DSM-4-TR, which stands for text revision, which just means that there were some minor revisions throughout. And I think that the next version, the DSM-5, is due out in another couple of years. It's 2012. But like I said, this is just a manual that clinical psychologists will use. It's interesting to flip through this if you want to go check it out. Most libraries have a copy on hand in the reference section. So it includes checklists of symptoms for all of the different disorders, as well as statistical probabilities, so the therapist can determine how likely it is that someone is experiencing one disorder or another. Because, of course, for certain disorders, they're more likely to develop in men than women, or in people of different age groups. So there are different ages of onset for different disorders. And so, for example, it's very unlikely that a child would develop certain types of disorders like schizophrenia, because that usually starts to display in late teens up through the early 30s. And so this, in regard to our subject matter today, the DSM lists out 10 specific personality disorders, and they get a category all their own, separate from other things like depression and social anxiety disorder and all those. So now we come to the question of, well, what exactly is a personality disorder? We know what disorder is, broadly speaking. So a personality disorder is an enduring pattern of experience and behavior that differs greatly from cultural expectations. That's your textbook definition. So there are a couple of key elements to this. One is this notion that it's an enduring pattern. So this goes back to our basic definition of personality. Personality doesn't really fluctuate much from one day to the next. It's something that sticks with us for the most part throughout our lives. And then the second part deals more with the abnormal part of it, the disordered part. So it differs greatly from what you would expect to see from most people within a given culture. And what we'll see is that these personality disorders usually affect people's thought processes, so the way that they interpret the world, the way that they interpret the actions of other people, the beliefs that they have, the attributions that they make. It might impact their feelings, so the moods that they have, how much anger they experience, how much fear that they have. As I mentioned, another common element here is that these folks with personality disorders often have problems with relationships, and they often have issues with self-control as well. So they might have some impulse that it would be in their best interest not to act on that impulse, but they really just feel compelled to engage in some type of behavior. I know I'm talking in generalizations at this point, but we'll get to the specific disorders with time. All right. So you can also think of personality disorders as being maladaptive variations of common traits. So we've spent the entire semester talking about this broad range of personality traits. And so it might be the case that sometimes people just have a version of this trait that is a little bit off. So I'll give you a couple of examples here. We talked about all those different needs in that, during the chapter on motives. So you could have someone who has a need for power, just like everybody else, but their need for power is really exaggerated, and it gets to the point that they really can't get along with everybody else because they think that everyone is trying to compete with them and they want to control everybody around them, and those types of people aren't all that much fun to be around. And so then you would see some impaired social relationships, they might have troubles at work, all of those things we talked about just a minute ago. You also might have someone who seems to have a lack of a need for intimacy. So this is another one of those fundamental needs that we talked about, and everybody has some level of a need for intimacy, but with some disorders it seems like their need for intimacy is just so low that they don't really care about social relationships at all, and they kind of withdraw away from other people. Right? And that can be pretty unhealthy, psychologically speaking. Another characteristic of personality disorders is distorted cognitions. So what you'll see with these disorders is that people will consistently misinterpret the behaviors of other people. So one that we'll talk about that's a great example of this is paranoid personality disorder. So we'll go into more detail on that next time, but these people just think that other people's actions are working against them, and that everyone's out to get them. And then finally, one last characteristic that you see in a lot of these personality disorders is extreme variations in emotion. So as we said back in the emotion chapter, everybody has some level of affect intensity. Sometimes we feel emotions very strongly, sometimes they're mild emotions, but sometimes people with these disorders experience extreme amounts of rage or a whole lot of anxiety, so much so that they really have trouble performing the basic functions of daily life. Any questions about this stuff so far? All right. So